Hello, good evening, and thank you for joining us for this class on the 6 essential steps to building a successful functional medicine practice. My name is Tal. I'm the Educational Director at the American Academy of Functional Health, and we have with us today Dr. Chill.
Hi, everybody. Welcome.
And Dr. Chill is one of our mentors, and I asked him to join today because we are talking about building a successful practice. And Dr. Chill has a lot of experience with building both brick and mortar, two different practices, one in Arizona, one in California, and then he opened up virtual practices. And he also mentored our community members to be very successful in their practices. So I wanted to have him join us so we can answer questions, we can give you some tips, give you some guidance, how to do this in the right way, the right approach, right, Dr. Chill?
Absolutely. It's all about the strategies.
Exactly. And hopefully by the end of this class, you already have very clearly the 6 steps. I'm going to give you a 7th bonus step if we have time. But we're going to give you 6 essential steps, plus help you with setting up your mindset so you are going to be successful and hopefully avoid the many mistakes that we have made over 20 years in healthcare. So avoiding these mistakes, which can cost you time and money, and then of course doing things right so you are profitable and not stressed for cash in the end of the month, or where are my patients, or having no shows, or having patients or having you find yourself struggle with insurance billing. I don't know if any of you had that. I had that for several years, and it was not a fun experience at all. So we're going to talk a lot about today the specific steps, like exactly what to do. And then, of course, Dr. Chill is going to share a lot from his experience. So it's going to be awesome. So let's go into that. We got a few slides we're going to get into. Please put in the chat just to make sure that you can properly see us, that you can properly hear us, because there's a lot of information we're going to be sharing with you. So just put it in the chat so we know that you're there, you can hear us, and then we are going to, if there's any issues, let us know. So let's get started here. Okay. So what are we going to talk about today? We're going to talk about what simple steps nurse practitioners, nurses, PAs, physicians, pharmacists take. So our community is very diverse. So we have, I would say, when we first started, we had, I think our first class of graduates, it was like about 5 or 6 years ago, we had a lot of physicians. And then in the last 3 years, it really kind of shifted to a lot of nurse practitioners. We also have pharmacists, PAs, and a lot of what we're sharing with you today is not theory. It's actually things that we applied, we learned along the way, and then our community members applied to have successful practices. We're going to talk a little bit about how do you get your new clients. Obviously, there's Dr. Chill have already mastered the online part of getting clients, so he can talk a little bit more about if you just want to work from home, if you just want to be remote, or maybe you're traveling with your family and you want to see patients. Maybe you want to see patients from other places, right? Other countries, other states. We have people in our community that do that. How do you do that? Like, how do you get those clients, right? We're also going to talk about how to get clients to fill up your schedule with paying clients with zero investment of marketing. Like, literally, that's how I started. I hired my first mentor to give me the guidance and show me the strategies. And then I just went out there and I fill up my schedule, right? I hadn't literally, and I didn't do it necessarily because I didn't want to do social media marketing. I just, when I first started, did not have money for pouring money into Facebook and getting leads, right? I just didn't have that money. So I used $0 marketing. I call it like free marketing, right? That's what what I refer to, and we'll talk a little bit about that. Insurance versus cash. If there are questions about scope of practice, put it in the chat. Otherwise, we're just going to skip that. But if you have any questions about it, ask us. We got lots of experience. We are not attorneys by any chance, by any means. We're not providing legal advice, but we have a lot of experience being in this field and mentoring and coaching other practitioners. 6 steps to building your practice. This is what we're going to be focusing the core of our time together. So most of you already know me. This is a picture of me in my first clinic with my wife over there. And this was my first practice. I did not have much money. It was a very small budget. My first practice, my first practice 20-something years ago, then invested all my money in continuing my education, getting a doctorate, going into 3 different functional medicine programs. And some of them were like $20,000. One of them was like $35,000. They were really expensive. And I didn't have much money left. We moved to Oregon. We could only afford $650, $640, barely, but we were able to afford it. And I asked for a sink because I called the landlord and I was like, listen, I know you're giving us a really good deal for a clinic space, but we needed a sink, and there was no sink in that space. So he's like, don't worry, Tal, we'll give you a sink. We'll install a sink on our expense. I was like, awesome, that was incredible. And then I walked in for the first time seeing the sink, and I'm asking myself, is this technically the size of a sink? So you can see here, I'm kind of shocked. It was so tiny, but it's just humble beginning. That's how we started. I enrolled with all the insurance companies because that's what everybody told me, right? And then I started struggling. I was seeing patients here or there. I was in the insurances. It was rough, and patients would get denied, and my medical biller was taking 8 to 10% of everything that comes in. And I would bill for $250. I would get like $43. I was like, what happened here? Like, so at some point, after doing kind of treading water for like 4 to 5 years, I was stuck. And I was stuck at really trying different things. And you might be in that place right now. You might have started your practice, or you might be trying to grow a practice and you're stuck. Maybe you're just starting and you don't know where to start, right? And so, I met somebody who became later my mentor. He had a 35 years experience in business and built systems and all operations marketing system. And I asked him to be my mentor, and he asked me, Tal, how much do you make right now in your practice? And I said, I was like, I got like my insurance and cash, 60 to 70K a year. And he's like, and you have rent, receptionist, this, and I'm like, how do you get by with that? And I'm like, well, I do it because I love it. I love helping patients. I get really good results. I love doing it, right? And he's like, okay, so tell me, what's your marketing system? And I was like, marketing system? I was like, gosh, I don't know what's marketing system. Like, I just go out there and I do a little bit of networking at 7 a.m. and I hand over business cards and I ask for some referrals, and that's my marketing, I guess. And he's like, Tal, that's not a system. That's just you throwing things at the wall and seeing what sticks, trying to see what sticks. And I was like, yeah, I get what you're saying. And he's like, you need a system. I got one that I developed over 35 years. It's exactly what to do, exactly what to say. There's like different methods to do that. And I said, well, would you be my mentor? And to an agreement, I paid him. It was very expensive for me at the time. Said, I'll figure out a way to make it happen. Like I'll figure out, and just trust me, I'll get back to you. And I went back to my wife. We tried to think about it, and I was like, listen, this is going to be an investment like everything else, right? And so I called him. I said, here, I'm going to put 2 cards together. I'm going to take a loan over there. And we kind of put together that $12,000. And we started working. So every other week we had a call. he would tell me, okay, now you're going to apply this system. And I told him in advance, I don't have money for marketing. Just show me what you got, and I'll see what I can apply. And he's like, oh, I'll show you like 5 different ways you can make money without, without spending a dollar on marketing. And he was right. I trusted him that he knows what he's doing because he had a successful practice, and he knew what he was doing. Like everything that he told me, I used it. I got more clients, right? So every one of those strategies I used, and then that really helped me to build a successful practice. So I pretty quickly transformed my practice. He taught me how to get more referrals from my existing patients, which was the easiest way to do because they already know, like, and trust you. He taught me how to build programs and memberships, which literally within 2 to 3 months already more than doubled my revenue. And it allowed me to grow. So over the next 3 or 4 years, I applied the system that he taught me, and I modified them, I updated them. And Dr. Chill uses very similar systems. The new patient flow is how do you structure from the moment somebody calls you and say, hey, can you tell me a little bit more about what you're doing? From that moment of interested to the point where they say, okay, what's the next step do I need to take? The evaluation, the consultation, all that stuff, right? So your flow is really important for your financial success. If you don't set yourself up for success from the beginning, it's going to be harder for you later on. Ideal patient framework is who do you want to work with? How do I communicate in a way that speaks to them, that enters the conversation in their head? That's what my mentor always used to say. And we did some of that work in our workshop this Saturday. So if any of you were here on Saturday, we did some of that work. Health expert framework, how do you attract, become the go-to person? So when somebody in your community says, oh, my back is hurting, I have digestion problems, I'm trying to lose weight, I should go to so-and-so, right? I should go to you, right? How do they think about you as the go-to person and not somebody else? And then your signature talk is something that there's a specific class that Dr. Chill teaches on how to attract, how to put it on the internet, and then just it attracts and book and schedule patients automatically. So that's what big part of Dr. Chill is teaching. Consultation and close is how to get a prospect, somebody who showed up, they're interested, right? How to create that commitment for them to stay in your practice, to invest their time, effort, and money, so you can get them the results that they're looking for in the next 6 or 12 months, right? So that's all the different systems, and that really helped me to grow, right? So I was able to grow a team. We had 2 physicians, nutrition. We had an acupuncturist. We had a really great team. It was a great experience, and we were able to scale from that 60 to 70K that I was stuck. We were able to scale within a few years to close to $2 million in revenue. And that was all cash, not even getting into the insurance, just cash. You get paid the same day instead of waiting or negotiating for your payment. So I was working in the academy and teaching a little bit, working one-on-one with some practitioners or doing some live classes, which I still do. I still enjoy doing live classes. But then practitioners started reaching out to us and said, we're learning functional medicine with the academy. How can I get more patients, right? And I said, well, I have all these systems that my mentors gave me. I had 5 mentors over the years. And then I developed those systems. I adjusted them to a brick and mortar. Dr. Chill adjusted his systems to a virtual. I'm like, why don't I'll just give you the systems. Like, here's the system, just use them. And then we're here to guide you. We're not going to set you up free so you're just there by yourself. You're like, we're here. We're going to help you. And we've seen practitioners like Dr. Jacobo going from a stressful primary care facility clinic, running around, seeing 40 to 60 patients a day. And he wanted more time with family, he wanted more freedom. And so we helped him to transition. He started offering private consultations from home. We gave him the system, we gave him the guidance. And in his interview with me, I asked him, how how did you make that transition? And he said, Tal, I just wrote down everything you said. I listened to the practice building classes. I put it together, and then I had to practice. It was like that simple, right? And of course, if things come up, that's where you need guidance. That's why we're here. But now he left the facility. He's making a really good income. And then in his interview, he shared how he's actually feeling right now, he's actually feeling better about what he's doing because he sees the health improvement in his patients, right? And he works from home, so he's really enjoying time with his family and more free time. Then we applied it for nurses, registered nurses. Here's Rose. She's getting paid $200 per private consultation, virtual practice. Zerla was a PA in urgent care. She's now doing private consultations, earning $200 per appointment. So they're getting paid a lot more than they would get in the hospital or urgent care per hour. And so, but they're doing something that they're also more passionate about, which is something that I want for all of you. So the thing that when we build a successful practice, I want you to write down 3 things. 1, precision medicine. And I'm going to get a little bit more into like, what's the difference? Why would patients pay us? So essentially, it's personalized root cause care with better outcome, right? Precision medicine means that we don't give metformin to all the diabetes patients, right? I'm generalizing here, right? But it's more of a personalized approach of like, let's figure out what's wrong with your body and help your body to function better, right? Financial growth, we always want to think about where are we right now? How much do we want our practice to be earning? That's really, really important, right? That's the first question your mentor is going to help. Maybe the second or third question your mentor is going to ask you, like, what is your goal financially? What is your goal in terms of lifestyle? Also, that's the third thing, right? So if you build it right. Build it in a way that will serve you. If you don't want to work on Fridays and you want Friday, Saturday, Sunday off for family time, do that. You need to know it. You need to think about this in advance. If you want to finish on certain days at 2 p.m. because your kid has a soccer game or a swimming class or dancing class and you want to be there for them, do that. Plan your life for it. And I can tell you that once I was able to do that, today I'm not missing any of my kids' swimming class. Even if it's in the middle of the day, I am there in the pool with her, right? And it gives me a lot of joy to not miss those moments. And that's what I want for you. So 3 things. How do you offer personalized precision medicine? We're going to talk more about that. What is your financial goal and your lifestyle? That's really, really important. Okay. Okay. So let's go into, and Dr. Chill does not, I know that you've been mentoring a lot of our community members. I know that's something that sometimes comes up, right? For example, with one of our community members, Suzanne, a nurse practitioner, that you asked her, like, what is your financial like goal? And she said, I want stability, right?
And she went from, within a couple of months, right? Within a few months, she booked her schedule and had to hire somebody. And it's because she was able to put certain systems in place to allow for that growth of her business, right? And then it's also, she went from insurance-based to a cash pay practice. She was a little nervous and hesitant about it at first, but then after she started to do it, she was like, I don't know why I haven't been doing this whole entire time. A lot of people, there is like a little bit of hesitation with that transition, but you would be surprised at how many patients are at the kind of their wit's end, right? With how they've been treated in the conventional model, and they're looking for an alternative, and they're willing to pay for that, especially if you're bringing in added value and helping them to improve their symptoms and getting them to their health goals.
Yes, absolutely. And I love that you mentioned that, because that, from what I remember my conversation with Suzanne, who who reached out to us and said, I want to talk about this because she wanted to share this so other nurse practitioners, other physicians, other folks in the community will know about it, and maybe that'll help to inspire others. Because her transition was, it's the hardest part is really once you understand that it's possible, then the transition is fairly simple. When you know how and you have guidance, the transition is quite simple. But I got stuck there for a while too. I was like, my mentor was like, Tal, you're providing so much value. We should talk about cash practice. And I was like, no. I was like, patients will not pay. They only want their insurance used, right? And my mentor said, well, let's think about this, right? And that's where I started kind of my process of like, he's like, Tal, I'll show you how to do this, but you need to understand that option not only is better for you, but it's also better for them. Right?
Absolutely. And just kind of like how, as practitioners, we personalize the medicine from a functional medicine perspective. Everything's personalized medicine, right? Even in the business systems, like when I'm mentoring people, I personalize the systems for them. Yes, we have these systems, they're a framework, but every practitioner is at a different point in their career or in their practice, whether it's setting up, whether it's scaling, whether it's just managing it, right? And you have to have specific systems in place that's personalized to wherever they're at in their business structure.
Absolutely. And that's something that we truly value, because a good mentor can take a system and fits it for your goals, right? And
Absolutely.
We'll talk a little bit about Suzanne later, how she achieved, like one of her goals was like, she doesn't want to fight with insurance companies, and she definitely don't want that ups and downs in her like finances. She wants financial stability, right? So we can talk later a little bit about how exactly what you guys are adjusted there, right?
Absolutely.
Yes. So let's go into Dr. Chill mentioned so many patients are kind of like feeling like they're in the end of the road, right? Where they're not getting the answer. So let's talk about a little bit about why would they pay you, right? And so, of course, the question is, why is this service so urgently needed today, right? And I'll show you some statistics that you probably already know, and it's just going to be a little reminder. But this is, I know that most of you work in one-on-one with patients, and I wanted us to kind of take a step back and look at the whole picture of what's going on here right now in our country. And that's 6 out of 10 Americans live with at least one chronic disease. Those diseases they're terrible diseases, right? Heart disease, Alzheimer's, depression, diabetes. Some of those diseases can significantly or negatively impact your quality of life, right? Some of them can kill you, right? I mean, it's just flat out as simple as that. And we know that 4 out of 10 have 2 or more chronic conditions, right? So a lot of Americans, according to the CDC, are struggling. So let me ask you this. This is a little quiz I wanted to bring up because I saw this really interesting survey that was done. And I wanted to ask you, so I did the same survey on Saturday, and I brought, this is a different survey that I want to ask all of you. So how many of these chronic patients are dissatisfied or frustrated, according to a survey that I'm going to share with you very, very, very quickly. This is chronic patients, of course. Option number 1 is 3 out of 10. Option number 2 is half of the patients you're seeing statistically are dissatisfied or very frustrated. Option number 3 is 7 out of 10 chronic patients, and option number 4 is not clear. Anybody? You can guesstimate. You can put it in the chat and just guesstimate. What do you think that number is? How many patients do you think statistically that you're seeing every day are statistically just frustrated, right? So here's the interesting part of what the survey showed. This was done in University of Georgia, and they took a sample of Americans age 44 and older with 1 or more chronic conditions, and they found that 70%, 7 out of 10 patients with chronic diseases feel frustrated. And so what do you think that they were frustrated, right? This is really important for all of us, I think. If you're in healthcare and you're seeing chronic patients, wouldn't it be important to know what they're frustrated about? So let's take a look at what are the biggest frustrations. So the number one was patients keep coming back. They feel tired of keep describing the same condition over and over again. This was like 46% of those patients, right? So think about it. Patient come to see you, they get a prescription, right? They go home, they take the prescription, they still struggle from one or two symptoms, and then they feel frustrated. Now they have to call, make an appointment again, drive to your practice, or if you're doing it virtually, and then complain again that this drug doesn't work, or that drug causes side effects, or this, or they're still tired, but I'm still tired, but I'm still achy, but I'm still bloated, but I'm still whatever it is, right? Second thing is wishing their doctor had more time to speak with them. How many of you have sat with a patient and felt like the clock is running out? You're like, oh, wait a second, I got to talk to them about this, or look at that, or whatever it is, and you're like, I'm running out of time because I only have 15 minutes or 7 minutes or 20 minutes, right? How many of you have been crunched in this system where you're like, oh, like I need to practice, I need to provide, like I need to help these patients, and you just have to skip to the next one, right? And that's the insurance-based model that we know of, and it has constraints, right? It has benefits, but it also has constraints. And then 3, having functional limitations, which unfortunately, this is really the unfortunate side of being sick, is that you lose function, right? So this is really kind of where our America's health crisis is, right? If you take diabetes, diabetes type 2 is such a lifestyle diet. It's also inflammatory disease, but it's such a common condition. And every day, over 3,800 people are diagnosed every day in our country, right? With type 2 diabetes. And then, of course, it's number one cause for kidney failure, lower limb amputation, and adult blindness. So, it's really unfortunate that these conditions have such a terrible outcome for those patients, right? So why would patients pay you out of pocket for functional medicine appointments? That's because as a functional medicine provider, you understand the triggers of chronic disease. You can offer solutions that other providers in your area do not have and cannot offer, right? Your knowledge is what's going to help them transform their health, right? So that's where we understand the differences between standard of care and functional medicine. So if somebody wants to use their insurance, right, they're going to find a practitioner. Maybe they'll have a $20 or $50 copay. Maybe they have a deductible. A lot of Americans today have $5,000 or $8,000 deductible, which is a big barrier, again, to getting the care they need. But typically, you go into a doctor or a nurse practitioner or a PA or whatever it is, and you are going to get a prescription, right? The prescription, the treatment is focused on managing your symptoms. So you have joint pain, here's NSAIDs, here's steroids, here's whatever it is. Here you got diabetes type 2, here's metformin, help regulate your sugar levels, right? But in functional medicine, you are going to do something different with your patients, right? You're not there to just manage their symptoms and conditions. You're there to help them to find out why they're sick, right? And when you talk to your patients, I want you to use those terms, right? In functional medicine, what we are doing is we're using this approach to try to identify why you developed type 2 diabetes, why you developed arthritis, what's contributing to the flare-up, right? That is the most important thing, and that is a big part of where the value comes in, right? The value of what you're doing. Second to that, standard of care, when patients use their insurance, they typically get either drugs or some coverage for their surgery if it's indicated. But with functional medicine, we use natural solutions. Remember those words, because I'm going to get back to those later on. But we're using nutrition, we're using herbal medicine, we're using integrative medicine. And the goal of each one of those types of health approach is very different. Standard of care, we want to mitigate, right? We want to mitigate some, I heard practitioner call it mask the symptoms, but we're trying to manage it. The downside to it is that patients can lose function, right? So I don't know if you notice, but when I look at the statistics about type 2 diabetes, for example, it's horrible. A lot of patients get a prescription. The problem is that every day over 340 patients with type 2 diabetes die because of those complications that they develop down the road, right? So maybe not necessarily diabetes type 2, but they develop cardiovascular conditions, lose kidney function, right? Lose eyesight, right? They're even calling dementia type 3 diabetes right now. So they develop complications, while in functional medicine, we help them improve their health. So if you take one thing from this kind of illustration, when you talk to your patients about what is functional medicine, explain to them that when we use the insurance model, we are focused on management of diseases and symptoms using drugs, mostly drugs or surgery. Unfortunately, that doesn't allow us to focus on what's causing the disease, right? When we use functional medicine, we are focused on, we're trying to find what's causing the disease, what's contributing to the disease. We use more natural approach, so less drugs, right? And it's all about health improvement. It's getting them better, right? Not just managing the problem. We're trying to actually correct the problem, right? So I'm not going to get into the 3 levels of care because that's a whole different lecture that we have. But I wanted to show you the different types, the way that the academy teaches the functional medicine, which I love. Very different than other academies that just focus on a lot of the theory of the pathophysiology and going into the different pathways. Here, we're really focusing on 3 different levels. One is when they come to see you and you prescribe them, what type of nutrients, supplements, dietary strategies you can already give them, right? So they can take it home, start improving their health, right? Doesn't require a lot of investment of time and effort, right? Or money. The second level is the proactive wellness. So what can they change in their, is there a dietary pattern or lifestyle pattern they can follow that will start improving their, let's say, insulin sensitivity, right? Or improve their metabolism, right? The third level is the deeper, which is we dive into the mechanisms, functional medicine labs, how do we identify what's wrong? And then we have a which is quite incredible. So this is something that I wanted to mention. This is important. So based on everything that I showed you here, just remember that price is the transaction, but the real value is the transformation. That's what I want you to focus on. Don't focus on how much it costs and how much would I charge. It's really about the transformation, because patients don't invest in the dollar figure. They invest in the outcome, the results that they want, and the life change that your services create. In terms of weight loss, that's pretty simple, right? A lot of practitioners come into our functional weight loss program because they want to learn in just 2 months, what can I do to help my patients to understand the root causes and lose the weight, right? That's all it is. They want to help their patients to feel better and look better, right? It's pretty clear. With other conditions, maybe a patient will come in and pay you $500 or $3,000 for your program, maybe become a member of your practice because their joints hurt. And what they want is less pain so they can go play with their grandchildren, right? Every patient come to see you, they don't necessarily want the drug. They want the end result, right? And that's the problem. That's a lot of the issue that we're having right now with healthcare, right? It's practitioners don't focus on necessarily on the outcome. They focus on not the patient. They focus on the disease, right? So remember, when patient comes in, it's not about how much you charge, right? could be too little, too much. It doesn't matter at this point. What matters is that you understand how to convey the value and explain the value of what it is that you're doing. Because if I'm feeling sick and my joints hurt every day, and I try this medication and that medication, I paid a lot of money for specialists, right? If you tell me, Tal, I can help you. If you come see me 3 times or 5 or 6 times, I can help you together to figure out what's wrong with your body. Why is your body so inflammatory? Why are your joints hurting? And I can give you some guidance to reduce pain and towards less pain, better quality of life. It will be worth it for me to pay. I would pay for something like that, right? Because I'm sick and tired of being sick and tired, right? If I'm always in pain. So that's really important. And that's really why you go into functional medicine and integrative medicine. It's really to learn about why. Why is it, right? Beyond its old age or its genetic or all of those, right, can impact the person, but they're not. In functional medicine, you actually learn what's triggering that inflammation, what's triggering that oxidative stress, that damage to the organ, the insulin resistance, that all of that stuff. You learn about all of that stuff very specifically. You learn about the pathways. You learn about how our environment, what we eat, what we drink, what we're exposed to, what happens in our gut that changes, that what happens to our cellular function, right? You learn about all of these mechanisms and how it can cause sickness, and then how to improve it, right? How to fix the correct it. So I want to share with you Gina. She's one of the practitioners who came to see us from the oncology department. She was very hesitant about going to functional medicine, but she reached out to us because she had no other places to go to. She has a personal story that she shares on her website on how she had a family member, through a family member, this journey with cancer. And she said, the more I read about functional and integrative medicine, the more I understand that patients are not told all the options that they have. And patients should be well informed to better take care of themselves. So she got into the program, and she was just telling me how much she have learned that can transform patients with oncology. She started in a small room, just offering consultations here and there, and she started applying everything we told her, all the strategies, and now she left the oncology department fairly quickly, within a few months, and then now she's in full-time practice. So I did a follow-up with Gina. I just wanted you to take a look at that, see how she built a successful practice, and then we'll go into the 6 steps you need to have in place for a successful practice. So let's go into that.
I knew I couldn't work 12-hour days at a hospital giving my normal treatment. And patients were coming in more and asking more questions too. And I really didn't like that I didn't know the answer. I knew the answer I was supposed to say, but I didn't like that I didn't really know the answer, honestly, for them and transparently for them. That was frustrating because there is another part of this. I mean, we're missing a whole other part of disease, and disease isn't just disease. I mean, healthy looks different on every single person. That's when we opened and went through your program. Started in 10 by 10 room inside of another business right after I graduated with you. And then within 6 months, we hit 200 patients. I still don't have a website, no advertising. And now we're right around 800.
You went from like no patient to like 800 patients.
Yeah,
right, in
less
a few
than
months.
years.
Yeah, that's incredible. I'm so glad. I mean, it proves it, right, when your practice is growing so fast, that this is a needed service. How much do you charge per session?
So complex is $800 for the initial consult, and simple is $550. I have a 3-month waiting list, right? I have learned more in the last 2 years than I think I've learned in 24 years of practice. I've never had such amazing outcomes. People are like truly getting better. And when I show them this whole, I get this adherence with these patients that they get better. They get better. It's amazing. It's just so amazing. And it's something that I can explain, show a connection to somebody that maybe doesn't understand functional medicine as much, another colleague or medical provider or medical doctor, and be able to express and show them something objective that they can't argue with. I haven't had really a lot of ego or pushback. I've had more referrals after, because their patients are getting better and getting them off medication, and their A1Cs are actually going down. Someone just left a review this morning online that made me cry. It was amazing. It was amazing. It's just, I can't even tell you the impact you have just by looking at the objective information in front of you and taking the time to care and put the pieces together. It's priceless. Absolutely.
Thank you for sharing that, Gina.
Yeah,
I really
that's
appreciate
because
it.
of you. I mean, I wouldn't
Yes.
be here without your program. So just know
Well,
that.
thank you. I really appreciate it.
So I wanted to share this with you because it always inspires me personally, and seeing practitioners such as Gina now transforming their patients' lives, and this is why we're all here. This is why you probably went into healthcare, is to help patients, and you're doing that every day. So we want to share that with you to show you that we can go well beyond managing conditions, and we should dedicate whatever we can to helping those patients to also improve their health. So down the road, they're not taking more pharmaceuticals. They are actually functioning better. They feel better. They have a better quality of life. That's really what this is all about, right? And I figured out a long time ago, having been in this industry for over 20 years, one of the first things when I first started, I didn't know much when I first started, but I had the basic knowledge and what I learned in the different programs. But I already saw patients that were starting on 1 or 2 medications. 5 years later, they're on like 9 or 10 or 11 medications. I don't know if any of you have seen those patients. And I started asking myself, well, if those medications are helping them so much, why are they started on like 9? I'm like, something here doesn't add up, right? It's like they need more medication than they needed before. And the more I understood functional medicine, the more I realized that they're losing function, right? They're losing their health. So this is why they need you to be there for them. So let's go into 6 steps to building a successful practice. This is where me and Dr. Chill are gonna talk to you about the important parts of having a practice. And so we're gonna start with the first one. And you can, if you have a pen and paper, you can follow up with us. We're gonna keep it as simple as possible. If you have any questions, please put them in the chat. This is why we're here for you. This is why we do this live and not just a recorded. We do this, we're here with you so you can ask questions. So the first thing, and this is gonna feel odd to you when I'm starting. Typically we go in straight into the, like, you do this and you do this. But the first thing I want you to think about is your offer. Your offer is something that we talk a lot. We actually have a whole workshop on creating different offers for your patients. So, but I want you to think about the offer. Now, to us, I'm going to do a little chart here. This is what it means to us, right? This is not the US, this is for us, let's say providers, right? But here I'm going to put patients, which is what patients want. right? So when we talk about the offer, a lot of practitioners are putting on their website that they do either functional medicine or integrative medicine, right? The problem with that, I've seen even practitioners when their patients ask them, what do you do? And they say, oh, I do functional medicine. The problem with that is if you ever try doing that and asking your patient, do you know what that means afterwards? Most patients will tell you they don't. They don't understand what you're doing. I had even a couple of patients that I said, oh, we're doing functional medicine. And they said, oh, awesome. Is that like, I was like, do you know what that is? And they said, yeah, functional. It's like that physical therapy exercise, right? And I was like, well, not exactly, right? So we always want to make sure that we communicate in a way that our patients understand, or potential patients. This would be on your website for somebody who just heard about you, they're dropping in. Maybe you paid Facebook or social media, you spend a lot of time on those, and you want to direct patients. Maybe you went out there and talked to somebody and they're interested. You want to make sure that you have a way to explain what you're doing. Do not just leave it as functional medicine. So there's a few where with patients, what we want to communicate is what are the, for example, who we are, right? For patient, what matters is who we are and what we do and what is the result, what's in it for them, right? So this is like, let's call it the desired result, right? So these are the most important factor. These three parts are the most important parts of what it is that we're doing, right? So I'll give you an example. If I'm in focus on diabetes, right? I can go with something like, my name is Tal, and I'm so-and-so, your profession, or just say, my name is so-and-so. I provide natural solutions to whatever it is that your condition is. In my case, let's say I give an example of diabetes type 2. If you're focusing on arthritis, or if the patient that you're seeing is struggling with, let's say, PCOS or depression, right? So we offer natural solutions to depression, right? What does that mean to your patient? To your patient, it means I'm gonna get, you might offer me solutions to a problem that I'm having without more drugs, right? So I can say natural solutions to depression. To some of our patients, that's very valuable. In fact, if you look at Whole Foods, for example, the whole industry of Whole Foods is based on people paying 2 to 3 times more the value of what conventional, higher price than conventional stores, just because they want this natural solution, right? This healthy, organic, it's cleaner, it's better for my body, right? So if you're thinking to yourself, well, a lot of patients might not be interested in natural. I encourage you to think again, because statistically, 7 out of 10 adults in the US are buying out of pocket paying for supplements, right? So a lot of patients out there, they go home, you might have prescribed them something, they go home and they ask Dr. Google, what should I take for my type 2 diabetes or arthritis or headache, whatever it is, right? So a lot of patients are looking for natural solutions. The second thing that second option is we find and address the root causes of a certain condition, right? Is that something that patients can understand? If a patient came into a consultation with you and they ask you, doc, what do you do, right? You can say, oh, I'm doing functional medicine and integrative medicine. It's really helpful for type 2 diabetes. That's good, but what did they actually understand from that, right? But if you say, we offer in our practice to find, our service includes finding and addressing the root causes of your type 2 diabetes, what's causing it, and natural solutions to treating diabetes. Now they understand. They're like, oh, you're going to help me find out why I'm sick, why I developed type 2 diabetes, and you have natural solutions, which means that you're not going to necessarily prescribe me more and more drugs, right? So those are just two examples. Of course, we always, when we do mentorship, we kind of adjust things for yourself, right? So, Dr. Chill, anything you wanted to mention about that?
Yes, absolutely. So this allows you to allows your patient to really understand clearly who you are and what you do, because they're looking for solutions, right? And what I typically recommend to practitioners is, if you have a website or a landing page or marketing, though, that offer should be the first thing that they see. They should understand exactly who you are, who you help, and what you do within the first few seconds that they see anything that you're doing.
Yes, absolutely. When we get into more, I did a session once on a class on reviewing websites of healthcare practitioners. We probably reviewed a few dozens of them. And it was really interesting that one of the folks that I worked with was mentioning something interesting, is that the first 30 seconds, your potential patient scans the top part of your website. And if you are unable to convey in like 30 to 60 seconds what it is that you do, how you do it differently than others, and how would that benefit them, they're probably checking out, right?
Absolutely. There's a lot of analysis out there that shows that when people go to websites, they're there for 20 to 40 seconds, right? And you need to capture them within that amount of time. And if you just put, I'm a functional medicine practitioner or an integrative medicine practitioner, they don't know what that is, right? And a lot of this is what we see. People put functional medicine and integrative medicine. They talk about functional medicine and integrative medicine, but it doesn't talk about what you actually do for the patients and how you actually help.
Of course. And I want you to remember this concept also when you're going in for consultations with patients. So if you're trying to, on Saturday, we talked to a practitioner who was in our workshop, who wanted to transfer from insurance. She didn't want to do insurance anymore. She was a physician, and she wanted to transfer to cash-based. And one of the things that we explained to her is that you have to learn, when you're transferring from insurance to cash, now they're paying out of pocket, right? So that means that the value for them must be worth more than what they're paying. So if somebody comes to Gina and they're paying $800, they better believe that the value that they're getting, right, is worth a lot more to them than that $800 that they're paying, right? So this is the first step in building that value, which is having clarity in what it is that you are providing, right? So yeah, you can use terms like functional medicine when you get into like, okay, this is what we do. But at first, they must understand the value, which is natural solutions, so not more drugs, and then finding and addressing the root causes of diabetes so we can improve your health, right? So you can feel better, you can function better, right? That's the first thing. So now I left these blanks because you can fill them up with whatever condition you want to focus on. And as a pro tip, this is something that me and Dr. Chill are always saying, have a niche, right, Dr. Chill?
Absolutely. People want to understand that you kind of specialize in something, right? And that you understand it really well. And it makes the messaging really clear if you're going to be doing marketing.
Yes, absolutely. Clarity is one of the most important things. If I'm not clear at what I'm getting, and this is sometimes happen when I go to websites of different practices or companies, if it's not clear to me within 30 to 60 seconds, what do they do? Right. How do they do it to get, and what's the results that I'm going to get? I'm probably going to check out, right? Which means that they lost another client, right? So we don't want you to leave money on the table. We don't want you to lose money. We want you to be profitable. This is a big part of it. That's why we're starting with that. Now, of course, we're going to get into a little bit more of the technical stuff, which are important for your practice, and then go back to, again, more of the marketing strategies. So the next thing is legal entity. So legal entity, it's pretty straightforward. There's two types. There's LLC and there's S Corp. There's S Corp is essentially like a small corporation. It's like a solopreneur essentially. It's you. You are your business. With LLC, it is different. So with S Corp, it's essentially you are the business. With LLC, it's quite different. With LLC, you are not the business. The business is it's a different entity altogether. So which one is better? You can always consult an accountant, but I can share from my experience and from in the last 20 years consulting multiple accountants. I paid a lot of money on different accounting and practice building. There was one weekend seminar I paid $10,000 for. LLC gives you the best protection. If you open a practice as an S Corp, your assets, your home, your car, your bank account, everything is the same as your business. You are your business, right? And so that's a little tricky, even if you have a separate bank account, right? Because it doesn't give you as much of a good protection for your personal assets, right? So when you go in an LLC, which is a limited liability corporation, your assets, which means your home, your bank account, the money that you have, the cars, whatever it is, that's all separate from the business. The business now has its own assets. So it's completely separate, right? And that gives you much better protection. Now, some accountants might tell you it's better for you to file taxes as an S Corp. So what you're going to tell them is what I'm going to tell you right now. Once you pass the $100,000 or $200,000 or $300,000, right, you go to the accountant and you ask them to file your S Corp tax, right, while you are an LLC. So you can enjoy both worlds, which means you are an LLC, you get protection, right? You have protection. Your assets are your assets. The LLC, your business has its own entity, but you file taxes as an S Corp, which will save you a lot of money on taxes, right? So that's when you start growing and really going into beyond the $100,000, $200,000, $300,000, $500,000. You can save a lot of money in taxes by doing that. And then you need a tax ID. Tax ID is the second thing. So one is the legal entity. The second thing is the tax ID. So legal entity, Dr. Chill, there's a few places that can actually do that for them.
Yes, absolutely. If you want just like a free place to go to SBA.gov, right? The Small Businesses Association. And it's going to go over what the difference between an LLC is and an S Corp. You can literally just search LLC, S Corp. It's going to go through what the legal structure is, tax implications for both. And as Dr. Cohen was saying, you can set up as an LLC, get all of the protections, but then when you reach a certain tax bracket, you can ask your accountant to tax you as an S Corp through your LLC. And that's actually a really good hybrid way to set up your legal structure. But through the SBA.gov, you can even for free get your EIN. It'll walk you through that process as well. And it is a great resource to go to. And it's a reliable resource to go to.
Yes. So the Small Business Administration, that's the SBA. that Dr. Chill was talking about. Essentially, the legal entity is something you file with your state. So you just type in Secretary of State or Business Registry, and then the name of your state. And you can do it by yourself, but there's also companies out there that will do that for you for like $150. They do the whole process for you. It's pretty seamless. It's like, just let somebody else do that, because that's what they do all day long, right? Every day. And they already know how to do that. They're pretty much professionals at doing that, and they can get that all set up for you. So once you have that, and if you want recommendations of who to use, just reach out to us. We got the checkout. It's called the checklist, the clinical new practice checklist. Just put it in the chat if you want us to email it to you. We'll be happy to share it with you. We created this for practitioners just like you, has all the list of vendors and all of that stuff that we would recommend to look, including professional insurance. So that's something that we have recommendations for you to consider there as well. We're not affiliated with any of those, anybody. So if you go to somebody, we don't get paid for that. We just did our research for you, so you have more resources. So put it in the chat if you want us to send the clinical new practice checklist. Send it to you. Okay, tax ID is, so once you have the legal entity established with the state, then you're going to go to the IRS website or just call an accountant and they'll set it up. The tax ID, which is EIN, is very simple to get, doesn't cost anything. You can just Google it or reach out to through the SBA. They can help you get that as well. So now you are pretty much set. So you got your legal entity. We can have somebody else do that for you if you want to. Tax ID is you have a number from the IRS. It doesn't cost anything to do that. And then the third thing is you want the bank account. So essentially, once you have the legal entity, right, and you have the tax ID, you just go to the same bank that you have really good relationship with, and you just say, I need to open up a bank account. You take maybe $50 or $100, you put it there, right? And then you just need a checking and a saving account. Now, when I first started, we went to a bank. I'm not going to mention the name. It's one of the big banks, and they directed us to the business department, and they said, well, you need a receivable and receivable account and outgoing, and you need this and you need that. And they open us like 6 different accounts. Don't make that mistake. The banks are just wanting to get more commission from all of that junk accounts. Just have 2 accounts like you have for your personal, right? You have a saving account and a checking account. That's all you need, right? And now you definitely want this to be a business account because you want everything to be separate, right? So your business has its own bank account, you have your own bank account, right? Easier later when you start bringing more and more money, easier to show how much money I'm actually getting in my business, how much do I have separately in my personal. So that's something that would be, and again, that doesn't cost anything to open a bank account. Okay, the third step is collecting payment. So now we have our offer. We have what do we do, which is natural solutions to arthritis, diabetes, thyroid, weight gain, whatever it is. We help patients find and address the root cause of their chronic condition, whatever it is. So now we have what it is that we do. We have legal entity in place, right? We have our own private consultation practice. The third part, now we need a way to collect payment. We need a way for patients to pay us, right? So this is collecting payment. Now, luckily for us, we live in 2025 when it's never been this easy to open up your own private consultations, literally, because you have companies like Stripe, and you have companies like PayPal, which you can open up a business account for free. Doesn't cost anything. Even the process is quite simple. You just go to stripe.com, So this is stripe.com. This is paypal.com. You just go in, and essentially they will ask you for your business tax number, your business name, your bank account. You give them your business bank account, you put it in, and that's it. The process is super simple, right? And you can get started right away. With this, the cool part about this is that now you have a way to take payment, right? Which is really cool. So next, when we are going to look into, for example, an EMR, which is a electronic medical chart notes software, right? Where do you put your chart notes? An EMR, right, can connect to your Stripe, for example, right? And they have instructions how to do that. You don't need to need to have any technical skills to do that. I did it myself, and I'm consider myself a very low tech, but they essentially, that EMR will be connected to Stripe. So anytime a patient pay you, it goes into Stripe, right? It goes from the EMR to Stripe, and then it goes into your bank account. And that's the cool part about having a cash practice, which is patients pay you, right? And then that money on the same day, right, goes into Stripe, and then it goes into your bank account, right? That's the magic of having a cash practice. You know you're gonna get paid what the client pays you. There's no negotiated fee, right? You get paid what your fees are. So you got Stripe, PayPal. That's pretty straightforward. And then if you got an EMR, then you have a way to put your notes. So which EMR would you use? Don't go with expensive EMRs. That's my recommendations. If you want to go fancy, there's a software called Practice Better. But the downside to that is you're going to find yourself spending hours and hours and hours and hours on setting up all their settings and how to take a payment, all that stuff. And what I always tell practitioners in our community, the only two things you want to focus on and spend your time is providing excellent service to your clients so they get better results. The second thing is growing your practice. Anything else, don't spend too much time on, right? So, a more simple solution, and this is between $150 to $200. It's not very expensive, but again, the amount of time you're going to spend on it, it's just not worth it when you're first starting. The other solution that I would recommend is Clinico. Clinico is just $45 a month. Easy to get started. They got forms, they got intake form, they got a scheduler. It's simple to get started. You can take notes, right? You can take notes, and then from there, just take payment. Very simple. You can create an invoice easily. Clinical will just create, patient pay you $300. It creates an invoice for $300. Very simple, right? And again, $45 a month. I mean, it's really simple to get started with that. Dr. Chill, anything you want to mention about this step?
Yeah. What's great about the how to collect payments, right? Like through Stripe, PayPal, Square is another one. Know that they do have fees that are associated with that, but they will give you a weekly, they'll do a daily, a weekly, a quarterly, an annual printout. So that's going to help you really stay on top of your finances, and you'll be able to see exactly what you're bringing in and how you can kind of go about growing that as well.
Yes, absolutely. They already got all the documentation in terms of also taxes. Like you can actually connect your accountant, or you can, if you do it yourself, you can. There's Quick Tax. I think it's called Quick Tax.
QuickBooks.
What's the name of it?
QuickBooks.
QuickBooks. Yeah. So there's a software called QuickBooks, and that just connects to your Stripe, and it just transfers all the data reports. So it makes it very, very simple to do that. But yeah, you got it provides you all the reports, and it doesn't cost you anything. They take between 2 to 3% typically of what you're making, but that's fine, because when you make money, they just take a 2 to 3% from that. That's not a big problem. Okay. Now we are at number 4. So we want a way to communicate with patients. So there are several. So essentially, we need emails to communicate. So patients can email you. You can email patients. Essentially, communicating them, right? A phone and SMS. A lot of patients actually use. You'd be surprised how many patients like to use SMS. Just the most convenient for all of us. So we'll give you some advice. There are. What I would recommend is don't use your personal phone line. Either get a different phone line or go to Google Voice. Google Voice, you can connect your phone number and get a free like it's a virtual line. Emails, there are some softwares for emails. The problem with all of this is that you want it to be HIPAA compliant, obviously. So all of this needs to be HIPAA compliant, right? Because you're dealing with patients. So did I type in HIPAA? Can you Google it? I think it's double. So anyway, it's there are options for free, like Google Voice. You can get another phone line. There are softwares that can help you. It's AA. Okay, yep, that's what I thought I got wrong. So AA. Okay, HIPAA. So there are softwares that can help you, but it's better if it's HIPAA compliant, obviously, right? Even though we're not going to share information with patients. Now, if you're doing virtual, then use Zoom. Zoom has a HIPAA compliant. And there's a solution that is actually better than all of this, which Dr. Chill is going to talk about. But Zoom has an account. It's like $15 add-on a month if you want to use Zoom, and it's HIPAA compliant. So if you want to do that, you can do that. But Dr. Chill actually they're developed as a certain technology that helps us, and it's HIPAA compliant, and it's you get it as part of the Practice Accelerator program. So that's something you can also. Dr. Chill, want to explain a little bit about that?
Yeah, absolutely. It's a software that helps practitioners really start, build, and operate their entire health business, right? It's an all-in-one platform where it runs your websites, your landing pages, your payment systems, how you can email, you can SMS, you can integrate EHR. It's literally kind of everything you need to run your health business, and it's all in one platform. And it's also included within the Practice Accelerator program.
Awesome. So that's something that obviously, this is something that if you're interested, you can reach out to us. We included within the Practice Accelerator program. That's essentially has everything here, and this kind of takes us to the next one, which is your flow and message. So this really connects to what Dr. Chill was just talking about here. So here's the general flow you want to have with your practice. And then we're going to talk about how do you, now that you have all of these in place, a way to take payment, a way to explain what you're doing, the value of what it is that you're doing, and you have your business, you have an EMR, you have all that stuff. Now you want to get people in, right? So you can start helping people and start getting paid, right? So the system that Dr. Chill was talking about is really built on the principle of the funnel. This is called the functional medicine funnel. And it kind of looks like this. It's like a funnel. So think about a funnel in which things come in, right? It's kind of like a machine, and then things, right, happens in the back end, right, like on the bottom. So here we have potential clients, right? So let's call it potential clients. Let's call this. So this is maybe somebody that was referred to your practice. Maybe you did it, you ran an ad or post something on social media and people got interested in your services. Maybe somebody told them, maybe it's a referral, or somebody goes to your website, right? So the funnel, this is the functional medicine funnel. It's really designed to do four things. One is to get attention, right? Attention meaning like, you know, what is it that you do, like who you are and what it is that you do, how you can help them, right? And then develop interest, right? Now, attention just brings them to you, right? Interest is what takes them from being, we call them suspect, like they don't know you yet, right? And so they're not educated yet about what it is that you are doing, who you are, what you're doing, how is this different than any other, how are you different than other nurse practitioners or physicians in their area, right? All they experienced in their life until that moment is they go to a practitioner, they get a drug, and 70% of them are frustrated for whatever reason that is, right? So here is, in the next step, we develop interest, right? This is why I started step number one with talking with you about how do you better explain or explain better what it is that you're doing and how it's different, right? So this is interest. So now they're like, oh, okay, so you are different. So you focus on natural solutions for my condition instead of more drugs. You're focusing on helping me lose weight without counting calories. You're helping me to, you're gonna help me to find out why I'm sick, why I get sick. I was healthy before that. Why did I get sick, right? So you're gonna help me to figure out how to get healthier, how to get back my health, restore my health, right? So this is where the interest develops. Now we have to continue and nourish this relationship. We have to keep nourishing the relationship. This is the phase of desire. So now if you do a good job and you keep communicating with them, you keep building up that desire, they're like, oh, so now I'm looking for, I want your solution, right? This is where we get them to maybe watch one of your talks or a signature talk. This is where the signature talk actually comes very valuable because it builds that desire, right? You can build that desire in different ways. You can share a case study, right? I saw a patient so-and-so. Mary came to see me. She was struggling with weight gain. We found out that their hypothyroidism was because she had Hashimoto. It's inflammatory disease. She didn't know she had Hashimoto. And so we found out that it's she has hormonal imbalance because of her gut microbiome, because she was exposed to environmental chemicals, because she was eating inflammatory foods. Nobody ever told her that. We helped her to change that. And now she's feeling much better, right? She feels much better. She lost like 15 pounds, all of that stuff, right? So case study can create a desire. Also, there is a specific framework that we follow with this. Obviously, I'm just giving you an example. But then the next step is taking action. And taking action, right, is again, continuing the conversation into taking action, which means booking an appointment. Because nothing really happens until they book an appointment. Until they show up, nothing changes in their lives until they show up and until they say yes, right? Taking action, this is where we have a class. It's called we have a whole section. It's called the consultation, the secrets to successful consultation. And this is where we talk about programs, memberships, all of that stuff. So this is where your offer comes into place. Your offer meaning like what do you offer them? Memberships, programs, what are the different options? And then from there, they sign in and say, Amar or Danielle or Tanya or Victoria or Rosa, I want to work with you, right? Now, if you do this process right, you are going to build what we called the know, like, and trust. Right? The know, like, and trust. And this is important because they have to feel like they know, like, and trust you to commit to working with you and want to invest time, money, and effort to work with you for 3 months, 6 months, or 12 months. If you miss this part and you just skip into, I'm just going to book a call, I'm going to get them in, we're going to sit down for 30 minutes to an hour, and then I'm going to tell them about my amazing transformational service and approach that within the next 6 months can change their health or whatever it is. If you have not built the know, like, and trust, they will not pay, or they'll pay and they will not show up for the next appointment. So if you're getting patients calling in and saying, patients calling in and saying, I don't think I'm going to be able to make my next appointment, I'll just call you when I'm ready to make that appointment, and you never hear from them back again, just know you have not built the know, like, and trust factor. And it makes sense, right? I mean, if I go to a dentist and they're talking to me about a $12,000 procedure, true story, by the way, that happened to me, and I ended up going to 5 different dentists to get different opinions, right? And I stuck with the one that had an amazing process to build that know, like, and trust. And so at the end, I was like, okay, listen, I feel like I trust you, right? I'm going to spend that money, and over the next year, we'll do whatever we need to do, right? And I was like, I just need clarity from you. What's the next process, and how can I figure out the payment plan? That's what I need from you, right? Because I already felt like I know them, I like them, and I trust them. Dr. Chill, I wanted to ask you, because this is really interesting. I know that we used to do this manually, right? We used to manually reach out to these individuals.
Yes. And then at some point, there was a bunch of different platforms, right? Like you'd have to have something for your website and your funnel, something for your talk, and then something for your email, something to continue to touch base with everybody, right? It had to be like integrated. I think at one time I was working on 7 different platforms to do that entire funnel system. So what Dr. Cohen is talking about is you have that system, but you need something to run it, right? So there's software out there, and that's why I created this software, which is really, it's a platform that does all of that funnel system for you. And then it's a system that runs automatically for you. So after you set it up, which we help you set it up, it just runs for you in the background, and it works 24/7 for you.
Yes. So everything that Dr. Chill mentioned is I actually experienced that when we were doing it for several years. We actually had a health coach call patients and have these conversations with them, again, to build the trust in our practice. And it was so much time consuming. And patients, if we skipped one phase, patients would show up to the practice and they didn't know exactly what we're doing. So then we end up finding ourselves, instead of a 15 minutes consultation or 20 or 30 minutes consultation, we found ourselves with an hour consultation just trying to explain why it's important to do this and it's this way, and what's the value of functional medicine, because it's the first time they heard about it. It's like it was very exhausting, a lot of time wasted in doing that. And
it's expensive as a business owner, right? To hire a health coach to do that when they could be doing other things and really honing in on the patient's health and improving them, right? That's why technology is great. There's technology that runs all of this for you in the background.
Yeah, and that's exactly why we're so excited about this, because I've used this system that Dr. Chill is talking about in my practice, and I can tell you what we did, it's not a blank software, right? It's like, yes, you can send HIPAA compliant SMSs and emails and make calls, and you can call and they can call you, and it includes everything, right? But it's not a blank canvas. It has the steps inside of it integrated. So if you want to focus on type 2 diabetes, we just show you how to slightly adjust it so it's type 2 diabetes. And now you're creating the software sense that kind of nourishes and builds the relationship with the email sequence and SMS, and encourage the patient to schedule when they get to this point when they're supposed to take action. And it's cool because it does it all automatic, right? So I would be at home over the weekend, showing up on Monday, and I already have like maybe 5 or 6 booked calls already that I didn't even do anything. Like I didn't physically was on the phone taking orders or booking them. Like the system does it all for you. It includes a schedule, it includes HIPAA compliant, as I mentioned, phone, SMS, and that's all included with the practice accelerator. So we actually give all of that, and there's a technical team that we pay, and they set it up for you. You get an email, you get a website, you get the funnels, you get everything and then we guide you through that, right? Of course, the guidance is really important. You don't want to be just out there by yourself. And the tech, you don't, as I mentioned, there's no need for technical skills at all. There's a technical team that takes care of that for you. So I wanted to mention that because this is a really important part that a lot of practices miss. And if you don't have a very clear way to create this, it's really important you're gonna lose a lot of clients, right? You're gonna lose a lot of clients.
It saves a lot of time too, because if you don't have that system in place, a lot of times you're jumping on the call as the practitioner trying to sell yourself. And you kind of want to separate that selling process, right? So you could be the practitioner and really focus on the healing, right? You want a system that's automated to do that selling for you, to do that vetting for you, to have the clients understand exactly who you are. So by the time you actually get on in a discovery call or a free 15-minute consult with them, they're already ready to go. And you're talking about their concerns and how you can help.
Yes, absolutely. And there was a big difference with practitioners in my practice. So I had this guy who came in to work for us. We did interview. We were looking for a physician, and this guy came in. He was trained. We thought he was really good add-on for our practice, and they started working. We got them through they learned functional medicine, of course, and all that stuff. We got them in, and it was really interesting. On his first day, I checked in with him, and he's like, "So how's it going?" We booked him for just a few patients, and I checked in, and he's like, "Tal, I can't believe how much these patients are so motivated." He's like, this new patient, I've never seen him before. Obviously, it was the first day, but he's like, new patient came in, and they assigned him to this doc, right? And we did mentorship and coaching for our team members all the time, so they get better. And it was really interesting because we assigned this new patient to them, and he said, I didn't even have to explain like what this practice does. Like the patient came in and he's like, I already know what you guys are doing. I love your guys' approach. I think everybody should be doing it. And I just hope that you can accept me as a patient, that I'm a good fit for you guys, and then tell me a little bit more, give me some more information, all of that. And he's like, wow, this practitioner was telling me, I've never had that happen in my life, right? So,
and you need a system like that to do that, right? It gets them ready to understand who you are. So they're already ready to go. They're already motivated. They're just like, how do I get in? How do I start my first initial visit with you? How do I get into your program?
Exactly. And it also qualifies the folks that they might not be the best, they might not be your best clients, right?
Right. And you don't want to jump on a call with them if they're not ready to go, if they're not qualified. You don't want to waste your time, and you don't want to waste their time, right? Yes, so absolutely. This system vets all of that for you as well.
Exactly. So the systems are really a way to create, like we mentioned, it creates the interest, it attracts those ideal clients, it builds the desire change and know that there's a different approach, and then encourage them to take action. Very friendly, very professional funnels, but encourage them, and then they book a call. Now, once they get to your office or one-on-one, I would highly recommend the class that we have. It's called the Secrets of Successful Consultation, because that's where you learn how to help them to transition into long-term care in your practice. So that's really important. So let's talk about finding your clients. So now that we have all of that, we're going to talk about finding your clients. This is step number 6. So where do I find my clients? So I'm going to talk about, there's 7 different methods. I'm going to talk about one method that does not cost anything. Literally, you get clients for free, which sounds weird to you. It's like, Tal, how can I get paying clients for free? I'm like, yeah, it's possible. I'm going to show you how to do that. But Dr. Chill also did that virtually from home. So he's going to talk a little bit about how to do that. If you just want to sit at home and have patients coming into your practice, there's a way to do that. Thankfully, social media today is so popular, and a lot of our patients are there. So there's another way to do this online. But I'll just start, where do you find your clients? So there's different ways, right? So let's say I'm focusing on patients that have arthritis, right? So if I'm focusing on patients that have arthritis, have joint pain, where would I find these patients, right? So I can go to, I can find support groups, for example. So I can Google support group for arthritis and the name of my city, right? A lot of those patients, they look for places in which they can talk about their problems. Maybe some other members of the group have solutions, right? I can go to churches. We actually have one of our community members took the signature talk and the functional medicine approach from our program, and he does a lot of churches. He does a lot of church talks. So I can go to churches, right? I can go to, where else can we find our potential patients, right? There's a lot of places. We can find them in the library. So think about it. If I'm focusing on type 2 diabetes, high cholesterol, weight gain, arthritis, a lot of those folks are older and they are going to the libraries. Yes, people still go to the library. I'm sometimes shocked about it too, but I'm like, people still go to the library. And then the second, the fourth place is I can go to different companies. I can go to government agencies. Right? So what do we do now? We reach out, we just find the person that is in charge for their community outreach or wellness, or sometimes it's just a person that in charge of their classes, community classes, or the person that manages the support group, and you just email them or call. You say, hello, my name is so-and-so. I am whatever it is, nurse practitioner, or nurse, pharmacist, physician. I'm very passionate about working with patients that have arthritis and offering natural solutions to chronic joint pain, and working with patients to help them find and address the root causes of their condition, right? Again, that's where your offer plugs in. That's why I started with your offer, right? You'll be surprised. And then you tell them, just finish with, would I be able to volunteer for a 45 minutes talk just to talk about this unique approach that I'm using and how it can help patients, right? I'm not charging anything for that. I'm doing it because I want to volunteer for your community, right? You'll be surprised. I used to call libraries, and I would have other libraries email me saying, oh, I heard you did this over there. Can you come do this arthritis or natural solutions to type 2 diabetes? So I used to have a lot of those folks that would reach out to me and say, can you do this in our community? Cool part about support groups, libraries, and churches is that they promote it for you. You just need to let them know you need to close a date and then just go there for about an hour, talk to people. We have the framework on what to say and how to say it. And then just in the end, just say, if you're interested in working one-on-one with me so I can help you improve your health, here's where to find me. And where do you send them? Don't just give them a business card. Get them into your funnel, because your funnel is going to do the rest of the work for you, right? So all you got to do is say, here's this website. When you go to my website, I'm going to give you my free healthy cookbook, right? To help you improve your metabolism, improve your weight, feel better, have less inflammation, all that stuff. Go to that website. They put in their name and email on the website, right? And let the machine do everything else for you. Tell them who you are. It will tell them what you're doing, how it's different, what type of results they should be looking out for. How does it work, right? It will create the know, like, and trust, and then encourage them to book an appointment, and then they come to see you, right? So everything is just already there. But you got to be out there. You got to be out there, and you got to be out there for your patients. Now, if you are an introvert like myself, and you're like, Tal, there's no way I'm going to be in front of people and talk about this type of stuff, right? So I just want to tell you what my mentor told me when I told him that I don't think I can do it. And he said, Tal, why did you go into healthcare? And I said, I went to healthcare because I wanted to help people. I was able to use functional medicine, nutritional medicine, herbal medicine to transform my own health, get out of chronic pain after years of trying different things. And I want to do the same thing for others. And he said, so do it. If you have a strategy that can help patients to improve their health, don't keep it a secret. Please don't keep it a secret. Share it with as many people as you can, right? And that's what I did. I just went out there and I said, first time I went out there, my hand was shaking and I was like, I don't know what to do. And then I called my mentor and he's like, listen, I'm going to give you a PowerPoint. I'm going to help you modify it. And then you have exactly what to say, and you're going to be, exactly what to do and what to say. And it's going to be great. You're there for them, not just for yourself. You're there for them. And I'm so glad that I did it. So we have all of that stuff for you if you want to. We have that stuff for you. We have the PowerPoints and all of that stuff. We can help you adjust it for your niche. But remember, you have knowledge in your head that can transform the lives of hundreds and thousands of patients. And so don't keep it a secret. Please share it with as many people as you can. So that's one way. You go out there. It's pretty simple. After a while, I actually started enjoying it and just really helping people. It was really all about helping people, right? And I always used to tell them, learn as much as you can from my 45 minutes presentation. If you feel like, you want to work with me one-on-one, continue the conversation, let's do it. If you learn something and you just want to, you just want to keep on trying by yourself, that's okay too. Either way, I'm here to support you, right? And then Dr. Chill will also talk. So this is one way that I filled up my schedule for free. I didn't spend any money on marketing. None of this cost me any money. I did lectures in the Division of Human Services. It was great. I did one talk. They invited me. They called me and they're like, can you do more? And I'm like, yeah. I didn't know how much social workers are sick. Like, I've seen patients there. I've seen so many patients from the Division of Human Services. And so we're there to help patients that otherwise would keep struggle. Library, I had a lot of elderly folks that came in from the library and they were really good patients. Support groups, churches, like, right, fine. Where is your community? Where is your patients? And then Dr. Chill, you want to mention a little bit more about online, because online is great because you don't have to do any of that if you don't want to. You just pay for attention, right? You just pay social media and you get
Absolutely. You could either pay or you could do it organically, right?
Yes.
Where you're posting. So what Dr. Cohen is talking about is creating a signature talk. You could put that signature talk, record it, and put it as a webinar, right? And that can go online for you. And this is where it goes into that top of the funnel, right? Because that signature talk is going to really create that likability, creating the trust, building the credibility for yourself, right? And doing that and having it in a system, not only are you going to be able to put that talk as a webinar in a landing page, you're going to be able to collect their email, their name, and then be able to have regular touch points. Dr. Cohen talks about nourishing them throughout the entire process, right? From when they are a lead or potential client, even when they are a patient or a client, you want to have those regular touch points. What's great now is in the very beginning, that webinar system, that signature talk goes to the top of the funnel. You get their email system, and then it goes into the funnel. It nourishes them the whole entire way. You get them as a patient, it continues to nourish them. And it's really a whole system meant to bring that signature talk and bring it online, and then have it automated for you. And it's just running in the background for you. And I have practitioners that are doing both. They're going out and doing all of those talks, and they're also doing online, putting that signature talk and recording it and putting it through a system, a software that actually does all of that for them. But what you can easily do is, if you have time, you can post parts of that talk on social media. You don't necessarily need to pay anything yet, right? You can create multiple posts every day to get organic traffic. If you want to pay for it, you could do that as well. And you can boost your payments. You could run ads. You can run Instagram ads. But you need a system to capture all of that. And that signature talk will allow you to do that as well.
Yes. So one of the ways that we eventually to grow, because once I was going out there at least 1 or 2 times a week, and I was, I got to that $670,000 a year, and I had associates that were helping me obviously take care of the patients. That's where we started doing the paid ads, right? So it took me a while until I wanted to do the free stuff first, the free marketing, use my mentor's systems, and then we added online. Online was great because, as Dr. Chill mentioned, if you take your signature talk, which we give you the signature talk as part of the practice building program, which is essentially what to say. Essentially, it's what to say, how to say it. And when you put it online, it's there 24/7. So potential patients just click on it, and in like 45 minutes, they learn who you are, how you do what you do, why they should take up on your offer, how is it different, and then what's the next step, right? And of course, the systems keep kind of nourishing them, and so they don't forget or drop off or whatever it is. It keeps them focused on, you got to take care of yourself, right? And they get to your appointment. You can do that from that. The post, these 2 things, by the way, it's free to do. We actually give you the PowerPoint. We work with you on doing these classes that we have, how to adjust it for yourself. And then posting is also free. So for example, we had one of our community members, Dr. Nana. She developed, she's a pharmacist, and she developed a post. So she's using posts. She developed a program. It's to help patients with diabetes. And so the cool part about it is that she posts, and then she gets 3 or 5 more people that are interested, right? So we also have posts for you. If you want like kind of ready made posts, you can just copy paste into your social media if you want that. If you want paid ads, then you can do that too. You can go to Facebook and set it up and say, I want 20 people a day that are interested, right? I want 10 people. I want 100 people that are interested, right? And again, don't spend any money on ads until you have the foundation set up, and until you know how to do a consultation, so you feel confident when they come in, when they show up, you know how to help them transition and become loyal patients that sign in with you, right? Otherwise, it's just money wasted, right? So that's something that is really important. And then the last step that I wanted to finish up is this is a bonus. This is not one of the six. It's not one of the six steps, but I wanted to give you this as a bonus, and this is always follow up. Always. And I've seen most clinics that I've seen do not do this, and it's very, very unfortunate. In fact, most businesses don't do this. Now, just to emphasize the point, let me ask you this. Think about your favorite restaurant, right? Maybe a restaurant you really enjoyed a meal a few months ago, and you were thinking to yourself, wow, this was a nice evening, really maybe good wine or great atmosphere, nice music. The waitress was so nice. You felt so welcome. The food was really tasty. It was really great. And then once in a while, you're like, oh, maybe I should go there. Maybe, you're just kind of thinking about it. What happens if tomorrow they call you and they say, hey, thank you so much for showing up for dinner, right? We wanted to invite you to, we have like this special. You come in this Saturday, dessert is on us, right? We're going to be much more likely to go to that restaurant. I mean, I can tell you, I can think about just 2 restaurants right now that I'll probably go. I'll be like, yeah, desserts are on you, or a glass of wine is on you, or, you're giving me 10% off. Of course, I mean, yeah, I actually thought about, I had a good experience last time. Same thing with your hairdresser. Same thing with, with any types of service, right? And I'm sometimes shocked at how much there's no follow-up, right? Another story that I always tell, I went with a family member to this was a doctor in Oregon, and this guy was a sports specialist, right? And he was cash, right? He was cash, and the process was great. He had a process of nourishing and calls and emails and send us something, and it was great. And we got there, and he was like $350 cash, right? We got there, and my family member said, Tal, I don't know anything about this. Can you come with me? I was like, sure, just let me know when it is. I'll show up. And we got there, and my family member explained, it's like when I do squats or I try to exercise or this, my knee hurts and this and that. And great. He was like, okay, this is what it looks like. You should do this exercise and that. And he's like, thank you so much for coming. And I'm like, okay. And I'm like, on the way out, I was like, it's like, doc, what do we need to do? And he's like, well, I'll explain to you. There's like a treatment plan. We need to do a treatment plan. And then this would probably take about 3 months, right? We'll do some exercise and stuff like that. And you'll come to see me and we'll do this, right? Took us out to the reception. And the receptionist said, it's $350. Thank you. Would you like to book your next appointment? And my family member said, I need to check my schedule, right? And she honestly meant that. Like, she was like, I need to check my schedule. So she went home, right? And it's like 2 or 3 months go by, and I'm like, we had a chance to talk. I'm like, what happened? Hey, what happened with did you went back to do the exercise with this doc? And she's like, no, and my knee still hurts. And I'm like, what happened? And she's like, I don't know. It's like, she's got kids, this happened. Like, she's like, I don't know. And I'm like, and nobody ever called me to explain to me what the next step, like, what do I need to do and how much it's going to cost? I'm like, she's like, I don't know. It just kind of dropped off. And I thought to myself, so I went to their website and I checked, and it's like $350 for the initial, $200 for the follow-up visit. And I asked my family member, I'm like, how many sessions would you go? Like, if, just out of curiosity, if they would tell you that you need 6 sessions, would you go there 6 times? And she's like, probably. because I need to figure out, like, I want to go back to exercising, right? And I just calculated this simple thing. 6 times $200, right? $1,200 that they have lost just because nobody called the patient and said, how are you doing? How was your visit? Was it what you looked for? Were we able to answer your questions? I wanted to reach out. Dr. So-and-so told me that you had, he's creating this treatment plan for you, and we want to help you to feel better so your knee hurts less, right? So you can maybe possibly in the future go back to exercising and everything you wanted. I have next week, by the way, I got Monday or Tuesday. Which one works better for you, right? And then just book her. $1,200, right? And I'm like, how much money are they losing every day because there's no follow-up, right? So whatever you do, right, if you work with us or not, please follow up on the patient that shows up. Please follow up. If somebody's interested in your services, follow up. It's an opportunity for us to help another person, and it's the lifeline of your practice, right? So don't miss out. Don't miss out. Just follow up. If you don't want to do it manual call, there's a system that can do all of that for you and reach out and do the follow-up several times, but please follow up. So let's go back to the slides, and then we'll finish up. So we want to finish up talking a little bit about the 3 reasons. We got about 5 minutes. 3 reasons why our community members are so successful with functional medicine. And it really comes to proven strategies for success. Automated marketing systems are really important. And then one-on-one mentorship and coaching. Don't miss out on working with somebody like Dr. Chill, who was able to take so many practitioners to build a successful practice. It's kind of like, after being in this for 20 years, I made so many mistakes when I first started. It cost me a lot of money. I hired and fired 3 marketing companies. It was awful, right? It was very hard. Don't make the same mistake that I made. Now I understand that the foundation is like a 3 legs of a stool. You got the proven strategies, the automated marketing, and the one-on-one mentorship. If you remove the one-on-one mentorship and it's just you trying different things, it could work, but it's going to be a lot of struggle. And you can really progress much faster, because mentorship means that we take 10 years of experience and we compress it into 2 months or 3 months, right, of knowledge. We just like, here, do this, avoid doing that. Do this, avoid doing that, right? And then you progress, right? You progress a lot faster than you were by yourself. Second thing is the proven strategies. That's really important. You want proven. The key word is proven, not trial and error, but really using something that other practitioners use, knowing that this is what's going to bring you increase your revenue. Automated marketing, there's a lot of freedom in automated marketing because it does everything for you. And then personal mentorship is really where you get real-time feedback, what you're doing wrong, guidance, mentorship. We give you all the forms, everything's included, right? So you don't need anything. And so I always ask our community members, if just 3 to 4 hours a week could add $3,000 to $10,000 to your monthly income while changing patients' lives, would it be worth it to invest in a program? And if the answer is yes, then of course we want you to join the community, right? Because this is a really cool saying, which is transformation begins when we stop asking what will it cost me and start asking what is it worth. And I asked myself, when my mentor said it's $12,000 just for the practice building coaching calls, I was like, okay, it's a lot of money, but what can it be? What is it worth to me if I learn something from what he did in over 30 years, and I can add just $5,000 and gain some more free time, to spend with family. Like, would it be worth it for me if I can now bring an additional $60,000 a year? Would I pay $12,000? You know, I went for it, and so did our community members. So I want to share with you somebody that Dr. Chill worked with. She's still actually in our program. She didn't even get certified yet. She's already doing amazing work. She's got a different model, which she's going to share. It's different than what Gina does, but it'll give you another idea of what you can do in your practice. So let's listen to Suzanne.
I was in traditional medicine for almost 20 years. And then I got out of that because I didn't like seeing my patients not getting better. And I made it happen last year. I mean, I didn't really necessarily have the means to do it, but my husband was like, you got to spend money to make money. And so I said, you're absolutely right. And so I signed up for the program, and I was immediately using the mentorship that you guys provide with Dr. Chill, which has been amazing. I mean, wouldn't have been able to do it without that. I mean, the modules are awesome, but sometimes you need that real world collaboration to really help kind of get you through. And I think that even, some of the very most successful business people have a mentor or a coach to help guide them through their business stuff. So it's super important. It's important for everybody. Everybody needs to do that. And it just took off. I mean, I started getting client after client, and then this spring, that passed, I mean, it just blew up. I've just been very, very busy. I had to hire a health coach, like 4 discovery calls on the books for next week. I have a new client on the books for next week. I have a new client on the book for the week after that. So, I mean, I just been crazy, but awesome, all at the same time. And if you're in a position where you want to make that change bad enough, and yes, I was very nervous. I've never opened my own practice. I've never had my own business. I had help, but it is very scary to just step out and not into the unknown. But, you just have to have faith. And it'll work. So I do an initial consultation that's $300, and then if they decide to move forward with me, my membership's $313 a month. Some of them actually pay up front. I do have a few people that pay the whole year up front, and they do get a little bit of a discount off that if they pay up front.
Very cool. So this is what I mentioned before, the idea of financial stability. Suzanne and Dr. Chill, when Suzanne wanted more of a financial stability and not kind of ups and downs, and she wanted financial stability that keeps growing and keep compounding over time, that's exactly what Dr. Chill and her worked on. Dr. Chill, you want to share a little bit about your work with Suzanne?
Yeah, the whole mentorship thing, right? I met with Suzanne once every week, and we went through all the applications. We also even went through clinical stuff, right? So it's not just about the business applications. It's also about being a good practitioner, getting referrals as well. We talked about that aspect too. So it was really personalizing kind of everything that she needed for her business, and then also just for her patients and her cases.
Yes, absolutely. So there's a couple of things that are really important. One, with membership, the cool part is that for every $313, every new patient that comes in, that's adding $1,313, right? So think about it. If you're 10 patients in, 20 patients in, 30 patients in, right? Now 40 patients, now you're starting your month with like over $12,000, like right there. So Suzanne starts her month with like the income is already there, even before she even starts seeing the patients, which is incredible in my opinion, right? It's like mind blowing. Like imagine starting your month with like $6,000 or $9,000 or $12,000. You didn't even do anything. You didn't even see patients yet, yeah, right? Anything that comes beyond that, anything that like new patients come in or pay you $300 separately, that's just adding on to that, right? So that's incredible, and that's there's 5 different models of care that we teach. Mentorship is one of them. But if you are where you're like, Tal, I want to learn more, I want to be successful, I need something proven instead of trying different things for several years. I need something proven. I want cash practice. I don't want to be dependent on insurance or anybody else. I want to be able to produce my own financial future, have stability, and really enjoy what I'm doing. Then the Practice Accelerator is the place you want to be. This is where we give you all the systems. We actually pay a lot of money on the marketing softwares. So we pay a lot of money for that. We pay a technical team that will come in and put the website for you and the landing page. So it's very time consuming for a whole staff, for a whole team to do that. And then we also do one-on-one, like literally sit with you one-on-one to build your practice to be successful, like Gina, Suzanne, Rose, Dr. Jakova, all of those people, right? So we're very much invested because it's a lot of, it's not just we spending a lot of time and effort with you, we're giving you patent systems, and also we're giving you we're paying every month for you for the software, the HIPAA compliant softwares. So if you're interested, but if you're serious about this, Jacob is going to post the Practice Accelerator program, the link in the chat. Check it out, book a call. We're giving $1,000 scholarship this month until the end of this month for the Practice Accelerator. Again, my mentor asked for $12,000 and it was just a mentorship, right? I got some systems, but it was just a mentorship. Here you're getting everything. You're getting the marketing software, right? And you're getting all the consultation forms, the consent forms. You're getting mentorship. You're getting live classes and recorded classes. So we're with you to build your dream practice, right? We're very invested in that. And my mentor, I paid my mentor $12,000. We're doing for this class, we're doing 50% off, then $6,000, and there's $1,000 scholarship for qualified healthcare practitioners, those who really are committed to advancing their practice. So reach out to us. We got different enrollment options for that. And then if you are interested, if you have not gotten certified or have not learned functional medicine yet, I would highly encourage you to check out the Advanced in Clinical Functional Nutritional Medicine program, because we focus on the clinical application. We have amazing clinical mentors like Dr. Esha and Dr. Kim, and they have years of clinical experience. They'll show you, we have the evaluation and treatment guides for you and tools. So you can identify the root causes with your patients very quickly with the evaluation tool that you see on the screen. It's took us about 6 or 7 years to develop it, but it's an incredible tool that you should give all of your patients to identify the root causes fairly quickly. And then from there, we'll give you all the treatment protocols. Again, when you sign in this month, the reason I'm talking about this is because it does include access to the practice building, so you get in that. It includes the mentorship, so you get in that. It includes the clinical tools, the certification classes, and it also includes the phone app. So all the treatment protocols are on your phone app, and that's something that we're adding for this month as well. So reach out to us. We got an amazing program. We got payment plans if you need to. The goal really is to get you there within the first 2, 3, or 4 months to have already a successful practice, right? You can learn the clinical while we help you build your practice. So you can do that all together. If you just want practice building, then check out our Practice Accelerator program. Now, by the way, any of you who are watching this class today and you're already in the Advanced in Clinical Functional Medicine program, certification program, reach out to us. We're gonna get you free access to the practice building classes. So all the classes you're gonna get access to at no additional charge, right? We'll save you thousands of dollars just by being a member of our functional medicine community. So that's our gift to you for coming to the American Academy of Functional Health and trusting us in helping you become a successful functional medicine practitioner. If you just want the practice building, then reach out to us. We'll help you get started. So thank you so much. Check out the link in the chat. Jacob is going to put also the link for checking out the functional medicine program, which we have now the bonus package. As I mentioned, all of this stuff is included: the classes, the app, phone app, all of that stuff. Let's see, any questions? Put it in the chat. Me and Dr. Chill are here, and we're finishing up, so put it in the chat. I see one question from Tanya about scope. So how can you have a practice in multiple states without having multiple EINs, I'm assuming, or maybe I'm not reading it right, multiple businesses or multiple licenses maybe? Tanya, you can put it in the chat just to clarify. But I'll give you the general until Tanya is going to post in the chat. In general, there are several practitioners in our community that also offer functional medicine consultations out of their states, out of the state that they're licensed in. We have a whole 2-hour class on offering functional medicine beyond your state that was done by a healthcare lawyer who has a lot of experience with this type of practices. And essentially, when you are operating out of your state, you are operating as a health consultant, right? Same thing with nurses, registered nurses. Same thing with pharmacists or PAs. Same thing with any practitioner that doesn't want to do or cannot practice primary care. Have a strong disclaimer. We can provide you the disclaimer if you need to. Have a strong disclaimer that you have the patient sign in. And then you present yourself as a functional health consultant, right? And which means that you're not a primary care in that state. You're not a nurse practitioner in that state or a physician. You are a functional health consultant. You do not diagnose diseases. You do not treat diseases. You educate patients about the root causes of their conditions. Education is the key word, and then educate them about strategies to improve their health. Not treatment of disease, but health improvement, okay? EIN and tax idea. Okay, so if a patient pays your let's say you're in California, right? Somebody calls in from Texas and say, Tanya, I need your services. Can you provide a consultation? They pay your business is located, if it's online, they're paying online. But essentially, you do not need to have a business where the patient is. You do not have to have a business in Texas, because you're not filing taxes in Texas. You know what I'm saying? If you're in California, you're only filing in California, right? That's why you only need the EIN and a tax ID in a state that you are located in physically. Okay? Does that help, Tanya? Hopefully that helps. Yeah. For example, our practice was in Oregon, and so we would consult patients virtually from New York and other places, and we did not file taxes in other states, just your state, right? So thank you so much for being here. Again, check out the links in the chat. Awesome, Tanya. Awesome. Keep on doing the amazing work you're doing, and then we'll help you develop your practice. And check out the Practice Accelerator program. This is really where you want to be. You want to be in this community to be successful and accelerate your success. I want to thank Dr. Chill for being here.
Thanks for having me. It's been a pleasure.
Yeah, Dr. Chill, I just had to have you here because there's so many practitioners I talk to in our community, and they're like, I'm doing mentorship with Dr. Chill. It completely transformed like my practice, helped me with I was able to go out. And interesting, everybody that we're showing you here that I talked to, like Dr. Jacovo, Gina, Rose, the nurse, like all of them, Zerla, the PA, They came in with zero business experience. Like they knew nothing about what to do. Like, how do I open a practice? Where do I go? How do I get my patients? Like, how do I communicate what I do? Like they knew nothing, right? They started working, myself, Dr. Chill, have them work with Dr. Chill, and they have successful practices. So why not you, right? Why not you? You can do it on the side, 1 or 2 days, add to your income, doing something that you love. Or you can decide, I'm going all in and I want this to be my primary thing. And then maybe just work 3 or 4 days and have more freedom, right? Again, it's precision medicine. It's the root cause, right? Root cause and helping them improve their health. 2 is you want to build it that it's profitable, that it's supporting your also lifestyle, which is the 3rd thing, right? So precision medicine, profitable. The 3rd thing is your lifestyle is really important, right? We only get one life, right? So we want to make the most out of it, right? So thank you so much for watching. Thank you again, Dr. Chill, for being here. I really appreciate it.
Thanks for having me.
And thank you to our media team and Jacob, who are, I always say I'm the low tech, they're the high tech. And so they help us to be here with you and wherever we are. And thank you again for everything you're doing for your patients. I really appreciate it, for you being the guiding light for your community and helping them transform their lives. So thank you again. Take care in the meantime. We'll see you in the next class.